Welcome to our latest episode of Wellbeing Wednesdays, the National Council's virtual series on healthcare. Join us as Brent McGinty, President and CEO of Missouri Behavioral Health Council, leads today's conversation with Senator Roy Blunt from Missouri, the top Republican on the Senate Health and Appropriations Subcommittee, and Chuck Ingoglia, President and CEO of the National Council for Mental Well-Being, to discuss the Senator's role in the expansion of Certified Community Behavioral Health Clinics, CCBHCs, his work on mental health and substance use reform, and his incredible legacy in public office as a member of the Senate and House of Representatives. To start things off, here is Missouri Behavioral Health Council President and CEO, Brent McGinty.
Hello, everyone, and welcome to today's edition of Wellbeing Wednesday. I'm Brent McGinty, CEO, President of the Missouri Behavioral Health Council. I'm honored to be joined today by Senator Roy Blunt, who has represented my home state of Missouri in Congress for over 25 years. After a long, illustrious career of public service to both Missouri and this nation, the Senator will be moving on to exciting new opportunities starting in January. But before you get away, Senator, we want to spend a few minutes today to talk about your career in the House and Senate, and in particular, some of those areas you have worked on in the healthcare space. Senator, good to be with you today. Welcome. And do you think we can find a few things to talk about?
Well, I sure do, Brent. It's great to be with you and with your colleagues from around the country. I think I had a chance to attend one of the meetings when people were back to Washington for the first meeting in a long time here in person. And of course, we had a great meeting with you and with our friends from the federally qualified healthcare centers that you work so closely with in our state in ways that in many places they're so ingrained you can't tell where one stops and one starts. And of course, as you implement a goal of treating mental health like all other health, that should be seamless in almost every circumstance. And I think we're seeing big things happen. And I've been pleased to be here. 14 years in the House, 26 altogether, 12 in the Senate and 14 in the House, and tried to make the most of the last 2 years. And now we're down to just the last few weeks. And
not much time left. That's right. Well,
not much time left.
Thanks for joining us, Senator. And we're also pleased to have with us my friend Chuck Ingoglia from the National Council. Welcome, Chuck.
Well, thank you, Brent. And Senator, I think we have the wonderful opportunity to take some of the learnings from Missouri and help spread them around the country. And I know that our members, community mental health centers and other organizations that provide care around the country are so grateful to you for your leadership, for your vision, and are excited about the opportunity that you have helped create to really bring mental health and substance use to be aligned with primary care and to be treated the same way so that more people can have access. So just look forward to this conversation today.
Me too, Chuck. Glad to be with you.
Yeah, thanks for teeing that up, Chuck. And we're obviously going to spend some time today talking about the Certified Community Behavioral Health Clinics, or what we now I think, Senator, we finally got it now, CCBHCs. It's easier to say now than when we started.
Took me a long time to get there.
That's right. But for those of you out there who may not know, Senator Blunt was behind this CCBHC movement from the very beginning. And while we mentioned CCBHCs are now a national policy and priority, that certainly was not always the case. It's taken a long time to get here. But Senator, before we kind of get into that, would you mind sharing what got you interested in these issues in substance use and mental health care, behavioral health care in the first place?
Almost everybody that I work with on this has a really good personal story to tell. And I don't have in terms of somebody in my family or some moment when I realized that this was a huge problem. I would say that Senator Stabenow from Michigan and I have worked closely together on this. We were freshmen in the House together. When I came to the Senate, we pretty quickly got into this discussion of what we could do with mental health, and we're going to get back to. I want to have that discussion really of the whole floor activity on this and how important Debbie Stabenow was in really both the concept and the intensity that it takes to keep focused on something like this. And then frankly, the timing and good luck it sometimes takes just to have the right thing at the right moment and be able to push it forward. I think we've done that. You know, I was a statewide elected official in Missouri, the first Republican elected Secretary of State in 52 years. And in that effort, I very well remember the first discussion I had on this. I was in a significant but small newspaper office in Kennett, Missouri, in the Boot Heel. And the guy who ran that paper and owned that paper, a guy named Jack Stapleton, wanted to talk about this. It had been one of the issues he'd cared about for a long time. He said, you know, Roy, he said, we're better than most states at this. We're not nearly as good as we should be, but we've had an unusual commitment in our state to mental health. And really, there's nobody in state office right now who's seized the mantle to make that one of the things that they integrate into their other work. And from that moment on, I've always been interested. It was great to hear that our state was doing more than other states. But of course, when I talked to any of your colleagues over the last 30 or 35 years, they had some sense we were doing better, but there was so much to be done. It was hard for them to imagine that this was better than what other people were doing in our state. And so, you know, since I was elected Secretary of State in 1984, this has been something I've cared about, but really coming to the Senate, chairing the funding committee for Health and Human Services and Labor and Education, where all of these elements sort of come together. And then at the same time, having the dependency crisis on opioids become a big national issue while I was chairing that committee. All this has come together in what I think is a way that really allows us to make some steps forward. Let me tell one other quick story, and I know we've limited time here, but I'm gonna tell one other quick story. So on the last week of October, 2013, this was the year that Senator Stabenow and I first introduced legislation that would allow every state that could meet the criteria to get some assistance in a trial to see how a 24/7, 365-day a year certified community behavioral health center would work if they had those in their state. And that last week in October 2013, we went to the floor and we went through the last bill that President Kennedy had signed into law 50 years earlier. October of 1963, of course, only a few weeks before President Kennedy is killed. This is the last bill he signed, and it was essentially the Community Mental Health Act. And it really had two goals as we went through that bill for the country. One was to close the big institutional facilities that weren't serving anybody very well, and two was to replace them with community-based facilities that still had the same kind of 365-day a year access, had quality staff. And here we are 50 years later with a country that did a pretty dynamic job of closing those facilities, but had seldom stepped up or had stepped up in too few places to provide the other part of what that bill was inclined to do. And so, you know, we were able then to move forward with that legislation. And the next year, eventually, we're able to get an 8-state pilot, which then became a 9-state pilot. And we've got 9 states that for about 5 years now have been treating mental health like all other health in facilities that were proposed. It was that you have to propose a plan to Health and Human Services. You have to meet the criteria. I think 23 states applied to be in that first 8-state pilot. And eight of those 19 of them went through the entire process, and we can talk about that more too, because there's some federal help in putting that plan together. And then 8 states, and eventually we got to 9 states that have been doing this for a while and keeping the kinds of records that I think make it appealing to other states to look at, making the case why they should also be part of this effort to move forward on community mental health centers.
Yeah, thank you, Senator. And Chuck, kind of when did the National Council kind of start thinking this CCBHC concept? And then specifically, when did you get introduced to Senator Blunt as this potential champion for that model of care?
Yeah, I came to the National Council in 2005, and there were a couple of interesting things happening then. First, the administration at that point was putting a lot of money out to federally qualified health centers. And I would hear from our members, organizations around the country that were providing mental health and substance use, why can't we get similar kinds of investments? Why isn't the federal government doing this for us? And that same year, we got some language put into an appropriation bill asking SAMHSA, what kind of technical assistance do you provide to community mental health centers? And SAMHSA never released the report, but I do have the draft report that they prepared. And their answer was simple. We don't provide technical assistance to community mental health centers because there's no such thing in federal law. And those two things were really kind of were interesting, right? Because it's hard for the federal government to make investments in things that there's no structure for them to do that, right? There's no direct relationship. And that's really where the concept of CCBHCs was born. But I think there's also another really important part of that Senator Blunt got to, right? Which is we need national standards of care in this country for people with mental health and substance use, obviously adjusted to local need. But if you have a heart attack and you go to the hospital, there's a protocol that's going to be followed. If you have psychosis and go to the hospital, depending on where you are in this country, what you get is going to be completely different. And I think people living with mental health and substance use deserve, evidence-based care. So that was our concept. And Senator, I just want to say, how gracious of you to give Senator Stabenow so many props for her leadership and tenacity. But as you know, right, things don't happen from one party anymore, right? Everything's got to be bipartisan. And you've been just a steadfast, constant companion to her, helping her navigate, through the Senate. And I want to make sure that you get the appropriate recognition that you deserve for your role in making all of this happen. And, it's one thing to say you care about an issue, but as you know, it's a totally different thing to actually expend political capital to move something forward. And you certainly have done that in over and over again over these years. So I just want to make sure that you get the recognition that you deserve as well.
Well, thank you, Chuck.
And Senator, I think I'll just jump ahead because we're on the topic, but talk about a little bit about the start of that partnership and friendship with Senator Stabenow. And to Chuck's point, how important bipartisanship is on truly kind of these kind of innovative national kind of policy discussions, how critical that bipartisanship is in that process.
Well, to do it and to sustain it, I think it's really essential. I'm generally an advocate of the Senate rules. I think the Senate, I chaired the Rules Committee, so maybe we don't have that many rules. It's not that hard to advocate for them. But, there's a lot of criticism about, well, it takes 60 to do so many things. But I would say on the other side of that, one, it almost always requires you to look for at least somebody to help with the other side. And that's critical. There have never been 60 popularly elected Republican senators. Only less than a handful of times have there ever been more than 60 popularly elected Democrat senators. So that one rule really makes you look for somebody on the other side. It makes you think about how you put this together so that you can have a bipartisan partnership result. And that creates the chance that this is going to last. When I look at our friends in the House where I served for 14 years and was the majority whip most of the time I was there. So I was in the middle of that effort every day to get things done. But when you look at the House, which has changed a number of times in the last 15 years, particularly, one group comes in and they pass a lot of things that normally don't even get to the Senate floor. But 2 years later, another group comes in and they pass things that do exactly the opposite. And neither of those things happen, to where the requirement to find a bipartisan partnership makes a real difference. Senator Stabenow and I were in the freshmen in the House together. The first piece of legislation each of us passed was a fairly small bill in the Ag Committee that we both served on. Naturally, when I got here looking for ways to get things done, she'd be one of the people that immediately would come to mind. And I think on this topic, we both could see the importance of doing it and moving forward. And then when we had the terrible incident in Uvalde, Texas, a few months ago, almost a year ago, members said what they always say: well, we ought to have some pilot projects and we should do this and we should do that. And Senator Stabenow and I, within the first day of that discussion, said, look, we've got enough evidence now on how certified community behavioral health systems work, how they keep people out of the emergency room, how they keep people out of police detention, how they in fact keep people from going to the hospital very often for the non-mental health problems they have. And we could talk about that later if you want to, but there is an absolute nexus between your mental health and how your capacity to deal with other health issues. And the incredible savings there in just money, let alone health and time in the hospital. So we did that. It was the biggest single element of that community safety bill that passed in the spring after what happened in Uvalde, Texas. And now we have the opportunity over the next decade for the other 40 states, the other 41 states who aren't already in the system, to have a 4-year pilot that allows them in their state to put this in place if they want to, and to see what happens. And those deadlines are coming up pretty quickly. I think 15 states this time could receive up to $1 million each to come up with a proposal, make a proposal to HHS, and those funds will be dispersed. That $1 million fund will each be dispersed in March. So they're moving toward making that decision early in the year. I'm not sure how many states are in that application process now. And for funding reasons, we sort of limit this to 10 states every 2 years. And I think what Brett and Chuck, what states are finding is once you get into this space, you find out how easy it is to make the argument to your own state government. It's not only the right thing to do, but it's the cost-effective thing to do, widely supported by law enforcement, widely supported by emergency room personnel in hospitals, widely supported by families who suddenly think they have somewhere to go with their problem that's more than an overnight solution. And an overnight solution is not a solution at all. And so, we were able to do that. And I think also to consistently draw attention to the fact that just because this is a public safety issue, it doesn't mean that people with mental health problems are unsafe. In fact, they're more likely to be the victim of a crime than they are the perpetrator of a crime. But the people that have a problem, when you look, whether it's Uvalde, Texas, or things that have happened in recent weeks, there's almost always a fairly identifiable moment when if somebody would have known where to go, they knew there was a problem. Might have been junior high the first time that this problem came up with this individual, might have been high school, but might have been something at work. But, connecting that challenge with a person before they become dangerous to themselves or others. And there are so many places before that when these problems can stop, and you want to be able to have a society where people can talk about a mental health problem just with their family and friends and neighbors, just like they talk about any other health problem.
That's right.
And, I think we've moved on in our ability to share our health problem more widely than we might have when I was a kid. But we still are reluctant to let anybody know that that other problem is a problem in our family. And so you don't have the reinforcement, you don't have the support, you don't have the understanding. That's an important part of this whole discussion, I think. And so we're moving forward, and I'm anxious to find out in the next few weeks how many states want to be part of that next group. They'll go up to 15 grants and assume that out of those 15 grants, you have a real opportunity to have 10 states that could join the original 9. And let me say one other thing. We also, and part of this, I'll just pursue Chuck's praise of me. Part of this was I chaired the funding committee, so we were also able to get a piece of legislation passed where individual units in a state that met the criteria could also be part of this. And so I think there are 30 states that have at least one unit in the state, and we would hope those units in the state would become the focal point in that state to express our whole state should be doing this, not just 4 places in Texas or one place here and there. And so I think Senator Stabenow and I are both very excited to see this first big step into a 10-year process that gets us to where the country said they wanted to be 59 years ago.
Yeah. Well, Senator, can I just say you said a couple of things I think that are really important here. You talked about that when states get into this, they see the opportunity that's before, that bringing CCBHCs come into. And I think at the heart of that, right, is what we've tried to do in this model, what you've tried to do in this model is align what makes sense clinically with a funding model that supports that. And so often what I hear from organizations right now is there's so many things that they wish they could do or that they see people need, but the funding just doesn't allow them to do that. And this really kind of brings that together. And I think what I hear from CCBHCs is that they're allowed to understand and respond to community problems in ways that they've not been able to before. So that, to your point, we can have folks in schools or at jails or homeless shelters or other places in community where we know there's need, and we can finally be there early to intervene to help support people and to keep individuals and communities safe. I think what a great opportunity that is. You also you used the word luck earlier, and I just want to say, luck, right? What's that saying? It's the combination of preparation and opportunity, right? That right. This was a long time of things coming together, of that how critical that initial 8-state demonstration was, so that we could have data, how critical the investments through the appropriation committee were to help get people excited about CCBHCs. And so you helped manufacture that luck, right? And we're very grateful to you for that.
Right. And you mentioned earlier the federally qualified health centers. Essentially, actually, Senator Stabenow and I both, along with a couple of other members, I know Senator Cornyn was one, founded the Federally Qualified Health Center Caucus. And again, we began to look at that model, as you did, to see if there are more things we could use that model for. And I think the reimbursement model, I don't think it's oversimplistic to say, is essentially the same reimbursement model of the federally qualified health center reimbursement. You serve everybody. They have a government program, that's fine. If they have an insurance that covers this, that's fine. If they don't have, there's a sliding scale that works for virtually everybody of income versus cost. And then at the end of the year, you put all those income factors together and all your expenses together, and you have a reckoning of how this works out. And so another thing we thought we were fortunate to have when we expanded nationwide was a reimbursement structure that had been used now multiple times by multiple states that works. And of course, it is essentially that structure. And the current states, I think, are Oregon, Nevada, Oklahoma, Missouri, Minnesota, New York, New Jersey, Michigan, and Kentucky. So states from as small a population as I imagine either Kentucky or Oklahoma would be near the smallest, maybe Nevada, to as big as New York are in this study. So you can also begin to see how it works around the country. Missouri's sort of in the middle of almost, if there's something to be divided in the United States, equity, we get 2%. So we're very close to the middle of the country in terms of size and lots of other things. And so all of these states, I think every one of these states would be a great place to reach out and say, talk to us about this and tell us what you learned and what, if we're going to make a proposal, what you know now that you didn't know when you made your proposal, and how we make this work in the best possible way. Yeah. And it's very much impacted by the dependency crisis, very much impacted by quarantine and COVID. And you mentioned another thing there that made me think of in schools in person or in schools by telemedicine. You know, this is a particularly good field for most people. The telemedicine opportunity really works, particularly it works for ongoing checkpoints that maybe you're often going to be further away from your mental health provider than your other health provider. And I think another thing we need to be vigilant on here is to continue to try to leave that door open, that avenue open for telemental health. This bill we've talked about, the community safety bill, allows specific efforts to be made in schools for mental health. But I think one of those can be and should continue to be the opportunity to have that mental health with the best person you can deal with, who may not be the person who would be in the school that day, but someone that if you look at a screen, you're talking to and interacting with, just like we are today. And believe me, if kids in school today can do anything, it's look at a screen.
That's very true.
I don't mean that totally positively either.
Yeah, I hear you there.
It's very true. Very true.
Senator, you touched on so many important things about kind of next steps and your partnership with Senator Stabenow from the great state of Michigan, that I know Chuck is partial to as well, from his home state, and stigma and the importance of continuing to have that stigma reduction. And so we appreciate you touching all those. Chuck, maybe just briefly from a national council perspective, what's next on the horizon? The senator touched on a few of those, but from a national council perspective, what's those next steps?
Well, we've got such a great opportunity, right? Senator talked about, kind of the opportunity that exists right now for states to get planning grants, and we're certainly trying to support states in that effort. Senator Blunt, I think we have about 28 or so states that are going to apply, for those grants. And so we want to make sure that we have a lot of interest. We want to make sure the clinics are ready to become CCBHCs, that we're doing a lot of work there. And then the question becomes, once we get these wheels going, how do we sustain this over time? Are there other opportunities for federal legislation? Now, that'll be somebody else's problem, not yours, but, we'll continue to think about, are there other opportunities for further federal legislation to mainstream this even more with the Medicaid program? Are there opportunities in Medicare for CCBHCs? I think we've got a lot of fertile ground to build on, but, the building blocks that that have been put in place are so important for us even to have those future conversations.
And Senator, you mentioned kind of the opportunity to lean on other states. In Missouri, we were so blessed to be one of the original 8. And just a few little updates from Missouri that I wanted you to know, Senator. Here in just a few months, we're adding another CCBHC agency to cover the Fulton and Mexico, Missouri areas you know well, Senator. And I'm pleased to announce that'd be our 22nd And I'm pleased to announce that will mean regardless of where you live in the state, you will have access to the CCBHC model of care. And we're very, very happy about that. And over our 5-year demonstration, 37% increase in access to care, 156% increase in medication-assisted treatment. And I know, Senator, you mentioned this, we've analyzed the Medicaid claims, a 14% decrease in hospitalization costs totaling $15 million annually in Medicaid savings alone. And that's not counting some of those physical healthcare costs that we talked about before. So anyway, good examples in other states as well. And we're very appreciative of all your efforts.
And Brent, maybe I could just say, I think the other great thing that Missouri helps illustrate is that the power of this is making it widespread. And I think in the initial demonstration, states were maybe a little hesitant to do that. But I think when we now have the opportunity for states to think really holistically around how do they make sure we have coverage across the state. And I think that's the other thing we'll be focusing on, because the data from Missouri and Oklahoma and so many other states is so compelling.
Yeah. Mm-hmm. Well, Senator, as you prepare to leave the Senate, we're going to record this, obviously, but what advice would you give the next Senate champion for CCBHC and the model and its ability to provide that access to affordable, quality behavioral health care? What advice would you give that person?
Well, I don't know if that'll come from the person that steps up to sort of play my role in this. Will come from somebody who's already here or new members. I know I've already talked to 2 freshman Republican members about this who are very excited. Frankly, I talked to people, both Democrats and Republicans, during the campaign and said, you'll be surprised if you make this one of the things you talk about, the kind of response you get from people, because more and more people are concerned about mental health and have opportunities in their family to be trying to deal with these mental health issues. I would say the importance of bipartisan support here, the importance of continuing to look for ways to deliver the service. And in that point, I'm particularly thinking about telemedicine, which the federal government's always been very reluctant to do. And the theory before COVID was, if you make it too easy to go to the doctor, people go to the doctor too much. And the other view to look at that now is, if people go to the doctor more often, they may go to the emergency room or the surgery suite less often. And the same thing applies to mental health as it does to all other health. The difference may be the particularly significant delivery of mental health that can happen through telemedicine, and how you access that. Should you have, as you all think of standards, should you have, what kind of in-person contact should you have with people before you have telehealth contact only, and how often? How do you deal with schools more directly and more quickly? But from the congressional point of view, sharing the information you have. Brent, you and the other people in these other states have really got a great reservoir of information here. Not just the information you have about healthcare, but the difference that the local law enforcement people think this makes in their life. The importance of that becoming a significant element of how we deal with situations that have previously been seen only as an unlawful behavior, as opposed to behavior that really is dealt with in a different way than you deal with people just simply willingly breaking the law. And I think this is a moment here where people understand this. Juvenile mental health, pediatric mental health felt by families at a level that they've never seen before after 2019, 20, and 21. And it'd be a real shame to let this moment of openness toward dealing with this issue as an incredibly important and integral part of all health get away from us. So I'd continue that bipartisan effort. I'd continue that partnership with people who are in law enforcement or running emergency rooms. For decades, we let the emergency room and the police become the de facto mental health delivery system in the country. We closed a lot of facilities that had previously provided that. We didn't come up with the alternatives that we're coming up with in a greater way now. And nobody was well served by that. Emergency rooms weren't well served by it. Law enforcement wasn't well served by it. Certainly, and most importantly, the people that had mental health challenges weren't served by that. But those are our partners in trying to make the effective case of having some solution that's more than the most temporary solution of detaining somebody for an overnight or a day. And families need some hope here when they've got this kind of problem. And as a overall community in our country, we can figure out how to provide that hope. And I think we're on the track to do that.
Yeah, and Senator, we really appreciate your time. I know you're taking time out of your day while working and have votes and things. And I just want to say we appreciate so much you spending the time you've taken with us today. More importantly, I want to thank you personally for your friendship. It's really a lifetime honor for me to work on this issue with you as my senator and friend. I will never forget it, certainly.
Great to be with both of you. Chuck, do you have any final thing you want to say?
Well, I mean, just you reflected on, the work that President Kennedy did, 59 years ago. But you've really done so much to take that and make it real again. And I hope, it's just incredible. Our whole nation is incredibly indebted to you for your commitment to making that happen. So just want to say thank you.
No, thank you. Great to be with both of you, and look forward to seeing what's happening in a few months when I'm out of the Senate, but when states are applying to be part of the next wave of making this work, and the leadership of both of you, and again, particularly those who are leading in all the current states, will make a big difference, I think, in how we embrace this. Senator Stabenow and I did an event the other day. We had a discussion with the National Governors Association to be sure that the new governors were beginning to think about how important this was to them and their state and the challenges that face their states right now. So there's a real opportunity. I'm glad to have been a small part of it. Thank you all.
Thank you.
Thank you, Senator. Well, Chuck, I know the senator had to leave for a vote. I think it's most impressive that even though he's in a lame duck term, you just heard his continued commitment to meeting with governors, newly elected governors, to continue to do the advocacy. I think it's just such a rare quality, not rare, but it's such an impressive quality that he stays so committed. So we are gonna miss him, Chuck.
Yeah, we absolutely are. And I really I'm glad also that he is encouraging new members of the Senate to really take this seriously. And I think we're at an incredible inflection point. 15 years ago, it was very rare for the House or the Senate to talk about mental health or substance use issues. Last year, there were 40 hearings on mental health and substance use issues. This is just an incredible recognition of the need and the interest, and just so encouraged that we'll be able to hopefully find somebody who's half as committed as Senator Blunt will continue to have success.
Absolutely. That dynamic duo, we were blessed with Stabenow Blunt. It really was a point in time that we'll be grateful for in history. We'll look back and just be in awe of their amazing productivity in this space. But Chuck, I think with that, we probably, for time reasons, need to wrap this up. Always good to spend a little time with you, Chuck. Appreciate you and your leadership on this. As important it was for Senator Blunt and Stabenow and their House counterparts, having the National Council there advocating on our behalf was absolutely essential. So thank you as well, Chuck. And
oh my gosh, what a pleasure. I mean, the National Council, our commitment is to try to make care more available for more people, to strengthen the safety net. And what an honor it is to work with folks like you, Brad, around the country.
Great. Well, with that will conclude this episode of Wellbeing Wednesdays. brought to you by the National Council for Mental Wellbeing. Thank you and be well.